There we go. One thing I forgot to mention last class, and talking with Dr. Blair, I realized that you guys had something similar in your triple P. Is that what you call it, class? Yeah. Earlier, if I had to say that the sensory input, would you consider sensory input into the system? There's a word. Would that be afferent or efferent? Afferent, correct. So sensory information coming into the system is going to be afferent. And then the motor information coming out of the system is then efferent. Okay, that was one thing. I neglected to say that last class, and I wanted to be sure that I got that. Okay, questions about that? Okay, I was able to get all the drawings uploaded onto the Moodle slides presentation, so hopefully, and the videos are there. If anybody has any questions, feel free to email me, come see me, whatever you need. Okay, now today, hopefully everybody has their handout, we're doing blood supply to the brain, or CNS blood supply. And where I like to start is here. This is, my computer's a little bit behind. Okay, this is the heart. Does anybody know major blood vessels coming off the heart? You had that? That's the aorta, yeah. But in general, having a little bit of it, maybe? All right, let's go ahead and start labeling some things. So anybody that knows it, go for it. This is my rendition. This is the heart. And as Alex just said, one of the main blood vessels coming off of the heart, or the main blood vessel, is the aorta. Okay, everybody see that? So we're starting with the heart, and we're going to take a look at all the blood vessels coming off the heart that are going to supply both the anterior portion of the brain and posterior portion of the brain with blood. And if this is the heart and this is the aorta, for the purpose of orientation, I'm going to say that this is the right side of the body, okay, and then this is going to be the left side of the body. So the aorta is coming off on the left side. Everybody got it? So if you're looking at me, it's my heart, it's my right side, left side, aorta's coming off on the left side. There is a main blood vessel that comes off of the aorta that resides right here. Okay, one of the main blood vessels coming off right there. Does anyone know what the name of that blood vessel would be? No? Okay. That's going to be your subclavian. So since it's on the left side, coming off of the aorta, we're going to say this is our left subclavian. S-U-B-C-L-A-V-I-A-N. Okay, coming off the aorta on the left side, going to be your left subclavian artery. Okay, still focusing on the left side, there's going to be another artery that arises off of the aorta. Put that one right here. Okay, next to the left subclavian is going to be, that's going to be your left common carotid. C-A-R-O-T-I-D. So your left common carotid. So coming off the aorta on the left side, you have left subclavian. Just medial to that is going to be your left common carotid. Okay, a little bit different on the right side. Does anybody know what's different about the right side? It's going to be one main artery that comes off here and actually divides into two. That's going to be your Are you saying? No, that's going to be a little bit different. Those are going to be the main veins coming in.
Right.
Oh, no, yeah, no, right here. Coming off the aorta. That's okay. Feel free to guess. That's fine. That's going to be, instead of having individuals come off, we have just one main artery. And that's going to be your brachiocephalic trunk. So let's see. B-R-A-C-H-I-O. Cephalic, C-E-P-H-A-L-I-C, trunk, T-R-U-N-C. So on the left side, you have your left subclavian and your left common carotid coming off individually. On the right side, you have something known as your brachiocephalic trunk. And that brachiocephalic trunk actually divides into two. And on the outside, it's going to become your right subclavian. And then just medial to that is going to be your right common carotid. It's way up here. So here's your right common carotid. Okay? So similar. Big difference between the right and left sides is that on the right side you have your brachiocephalic trunk that then divides into your right subclavian and your right common carotid. On the left side you just have your subclavian and common carotid coming right off of the aorta. You see that? So that's starting from the heart. Now, coming off your subclavian, and I'm going to recommend if you have the colors, keep the colors consistent with me if you want to, or at least consistent between the two systems. So I'm going to use green for the vertebrobasilar system. So coming off the left subclavian and the right subclavian, you're going to have individual arteries that come up. Okay, I'm using green here, if you can see it. And that's going to form the basis for the vertebral basilar system. So the vertebral basilar system comes off the subclavian arteries on both the left and the right sides. This, like I said, vertebral basilar system, so off the subclavian, these are your vertebral arteries. So here on the left side, this is your left vertebral, V-E-R-T-E-B-R-A-L, artery. Okay, and over here on the right side is going to be your right vertebral artery. Yes? Absolutely. So the vertebral basilar system comes off both the left and right subclavian arteries. Okay, this first artery that comes off the subclavian is known as your vertebral artery. On the left side, off the left subclavian, you have your left vertebral artery, and on the right side, coming off your right subclavian, you have your right vertebral artery. Okay, and those arteries are just going to ascend, okay, straight up. And these left and right vertebral arteries are going to start to come toward the middle. Okay, and when they get to the level of something known as the pontomedullary junction, we'll look at that in a whole lot more detail, and I'll spell it as we get there. They're going to come together to form one main artery, and And that main artery is your basilar artery.
Can you make a difference?
Oh, yeah, thank you. B-A-S-I-L-A-R. Basilar artery. I'll raise it up just a little bit. There we go.
And that's the basilar artery.
That's the basilar artery, that's right. So coming off the aorta on the left side, you have your left subclavian. Coming off the aorta on the right side, you have your brachiocephalic trunk, which gives rise to the right subclavian. Coming off both the left and right subclavian arteries are the right and left vertebral arteries that ascend all the way up and come together at about the level of the pontomedullary junction to form one artery, and that's the basilar artery. And this, as you can see, is the vertebro-basilar system. Okay, this is going to supply the back of your brain with blood. Questions about that? Does everybody see where I am? Yes. Jonathan. I'm gonna, yeah, this is kind of a great big overview right now. I'll get that. We'll go into more detail than I'm sure you want to see. But this is where we are. I like to start out the class with just a basic overview. And you should know that the vertebro-basilar system comes off the right and left subclavian arteries. Okay, and that the vertebro-basilar system is going to supply the back of your brain with blood, for the most part. And we're going to go into a lot more detail than that. Grace, Taylor Grace? Okay, I think I understand your question, but let me know if this makes sense to you. Okay, so what I've done here is I'm starting with the heart, and I'm showing you all the arteries that are involved in forming the circulation to the back of the brain. What we're going to do from here is we're going to start with the vertebral, go up to the basilar, and look at everything else at the level of the brain. Does that make sense? Okay. So right now I'm just starting at the heart, and I'm telling you about the arteries that are involved in, this is the vertebro-basilar system, that's shown in green. And then there's one more, the anterior circulation of the brain, okay, is going to be coming off the carotid artery system. And what happens here? Oh, any more questions about the vertebro-basilar? Does everybody see? So the heart, subclavians or brachiocephalic trunk on the right, subclavian on the left, subclavian on the right, vertebral artery goes up, comes together, forms basilar. That's the vertebro-basilar system. Okay. What happens with the anterior circulation to the brain is that the left common carotid divides into two different branches. Okay. One branch is going to go out here, not really important for circulation to the brain. And another artery off the left common carotid is going to go straight up and supply the anterior portion of the brain with blood. The left common carotid is going to split into the left external carotid artery. And the important one, you need to know that circulation to the anterior portion of the brain is going to come from both the left and right internal carotid arteries. Okay, that's going to be the important one. Same thing happens on the right side that happened on the left. I'll just draw that real quick. So you have your common carotid that then divides into two. Okay. One branch. One branch is the right external carotid. The branch that we're going to be most concerned with today is going to be your right internal carotid, because that's going to be the one that supplies blood to the anterior portion of your brain. Yes, Paul.
So the red goes to the anterior portion, the green goes to posterior, and it's the right left internal carotid artery. Okay.
Right, left internal. Okay. They're both traveling up. They're both traveling up together, and we're gonna take a look at what happens. We're gonna start at the level of the brainstem to look at the vertebral basilar system, and then at the level of so kind of the neck up to look at the anterior circulation. And then we're gonna connect them. Questions? Other questions? Making sense? See where I am? Gabby? It's the internal carotid. Yep, the external carotid we're not going to worry about today. Dr. Blair is going to cover that in anatomy maybe next semester. Okay. The one that we're most concerned about that you need to remember is that the right and left internal carotid arteries are responsible for supplying the anterior portion of the brain. Or we'll look at exactly what portion of the brain today, since you guys know that. Yes. I don't know. Caroline? Alexa. I should guess, right?
What is this system called? Since the other one was the vertebral basilar.
Anterior circulatory system. Anterior circulation system. Yeah.
Where on the body do the right and left vertebral arteries typically meet to form the basal artery?
So good question. So it's at a place called the pontomedullary junction. And exactly what that means we're going to draw here in a minute. So give me one more slide, I'll show you. Evan, what's your name, Michael?
Okay.
Ben. Okay, Ben. I think I got most of the guys anyway. But there's a lot more girls, I'm in trouble. Okay, other questions for me? Does everybody see where we are? So, coming off the heart, main blood vessels, the aorta on the left side. Left subclavian comes off and left common carotid. On the right side, off of the aorta comes the brachiocephalic trunk. Coming off the brachiocephalic trunk, then you have your right subclavian, your right common carotid. Coming off subclavians, left and right. Vertebral artery. Vertebral artery goes straight up, comes in, and then forms a single artery known as the basilar artery. So the vertebral basilar system comes off subclavians. Okay. The anterior circulatory system, you have your common carotid split into external carotids and then internal carotids. Internals are going to be the ones that supply the anterior portion of your brain with blood. We're going to look in a whole lot more detail at each of these systems individually. Please show you. Do you have a question? Are you good? Okay. All right. Any more questions? Everybody see where we are? All right, let's move on. So that's the first one. Now, I'd like to look at the more difficult of the two. I like to get the hard stuff out of the way right up front. We're going to look at the vertebro-basilar circulation first. It's really not that hard, but this is just the harder of the two. Okay, let's do some labeling here. I told you this is my rendition. Kind of looks like an alien, right? With the eyes sitting out. So this is my rendition. This is the cerebellum. Remember, cerebellum's that thing that's involved in balance and coordination that we talked about last class? Last week, right? And this is going to be the lowermost portion of the brainstem. Does anyone remember what that one is called? Yeah, awesome. This is your medulla. Okay. This is the medulla. The middlemost portion that kind of sticks out a little bit is known as pons. Good. And then the uppermost portion of the brainstem, midbrain. Perfect. And just to give you some perspective, all I've done, this is just a transverse section right through the midbrain. So it sort of stops here. The rest of the brain would be sitting on top, or the cortical region would be on top of this. Okay, so this is just, and as would be expected, this is the spinal cord. I know there was somebody last class that knew something about cranial nerves. I'm not going to call anybody out, but if I tell you that in the midbrain here, one of the nice landmarks that I've drawn that looks like a pair of eyes is one of the cranial nerves. There's 12 of them. Does anyone know what cranial nerve that would be? That is your third cranial nerve. So this is going to be, these eyes represent cranial nerve number 3, which is also known as oculomotor. Third cranial nerve is oculomotor nerve. And that's going to be an important landmark when we look at the system. Okay, now what you're looking at here, if you were looking at me, this were my brain or my brain stem and my cerebellum, you're looking at a front-on view. Okay, so the brain stem is in the front and the cerebellum is in behind. Okay, is everybody oriented? See where we're going? Sydney, does that make sense? Okay. Is there something you couldn't read? Or?
Yeah.
All right. Okay, so if that's true, then this is going to be the right side. You can see that, right? This is going to be the right side, and then this is going to be the left side. Okay. Just trying to get you oriented. So the front, right, and left. Okay, now, going back just a minute ago, I was talking about 2 arteries that came off the left and right subclavian that go straight up to supply the posterior region of the brain with blood. What are they called? Vertebral. Awesome. So I'm going to draw those in here. So here's my left vertebral artery. It's going to come up. Okay, and then here's my right vertebral artery. It's coming up. Left vertebral and right vertebral. Okay, so this is just a continuation of where we were just a minute ago. I've just drawn those vertebral arteries coming straight up. And I talked about, and I guess Ben asked the question about where in the body do these arteries come together to form the basilar? And the answer to that question is right here. You see that this point right here is called the pontomedullary junction. So in other words, it's where the pons meets with the medulla. So right at the pontomedullary junction, which is right there, these arteries come together and form one main artery here at the pontomedullary junction, right there. And the name of that artery that they form that goes straight up, basilar, good. It goes straight up to just above the level of the third cranial nerve. Okay, so this is going to be my left and right vertebral come together at the point of the pontomedullary junction to form the basilar. B-A-S-I-L-A-R, the basilar artery. The basilar artery ascends up, and just above the level of the third cranial nerve splits off into right and left arteries. So I'll draw that like this. These arteries come off and then go backward. Supply the back of the brain, the very back of the brain, with blood. And we'll look at their territories here a little bit too. But for right now, you should know the basilar artery splits into, on the right side, you have your right, PCA, or posterior cerebral artery.
Can you repeat that?
Yes, on the coming off the basilar artery on the right side, the basilar artery ascends just above the level of third cranial nerve. Coming off the right side, you have your right posterior cerebral artery, and on the left side, you have your left posterior cerebral. And abbreviation for posterior cerebral artery is going to be PCA. So this is going to be your right PCA, and this is going to be your left. Okay, vertebral arteries ascend toward the brain. At about the level of the pontomedullary junction, they come together to form one main artery. That artery is the basilar artery. That basilar artery ascends to just above the level of the third cranial nerve and then forms two shoots. So what you see is it goes up and it's going to go backward. That's what I'm trying to represent. The right shoot coming off the right side is the right PCA or posterior cerebral artery. On the left side, you have your left PCA coming off the basilar, which is your left PCA or left posterior cerebral artery. Questions? Yes, John.
So after midbrain, then they're going posteriorly. That's why it's called.
So yeah, we go up and then going straight back. And it's going to supply this backmost portion of the cortical region. Do you remember what that's called? Anybody? What's the backmost portion? Occipital. Awesome. Yes, occipital lobe. Okay, so the PCA is going to. We'll see that in more detail here in a minute. Just a question. But I'm trying to represent it coming up and going back. Alex.
So when you pop a blood vessel in your eye, is that due to the blood supply?
No, that's just pressure buildup
Okay.
in your eye. Yeah, the blood vessels in your eye are just localized to your eyeball. This is more, so that all of the main arteries in the brain, we'll talk about that in a little bit. How about next class? Let's just make it through this now. Good question though. But we'll talk about the main arteries and where they reside and all that stuff. So that's good stuff. Any other questions? All right. Now, not done yet. This is the vertebral basilar system. This is the basis of it. And coming off the vertebral artery here, coming off the vertebral artery down here, you're going to have, coming off the right and the left, you're going to have one main artery coming down. And this artery is going to be responsible for supplying the anterior 2/3 of the spinal cord with blood, and it is known as the, so just say ASA, which stands for, write it out here, anterior spinal artery. We'll get back to that one as the semester goes on. But coming off the right and left vertebral arteries, two arteries come together, form the anterior spinal artery. That artery is responsible for supplying blood to the anterior 2/3 of your spinal cord. We'll get into exactly which part of the spinal cord it supplies and all the tracts and all the neurons that are involved when we get to the spinal cord portion of the course. For right now, you just need to know anterior spinal artery, anterior 2/3. Okay? Now, coming off, again, the vertebral artery, right here, coming off right here, you're going to have arteries coming off the left and right, the vertebral arteries. Is there a question? Is there a question? Happy to answer it. No? Okay. Coming off the left and right vertebral artery, you have this artery. This artery is responsible for supplying the posterior inferior surface of the cerebellum with blood. Okay, there's one. Yep.
What is it?
It's. I'm going to write it down. So this is going to be on the left side. You have your left pica, PICA stands for posterior inferior cerebellar artery. So, PICA, posterior inferior cerebellar artery, supplies the posterior inferior surface of the cerebellum with blood. Make sense? Got it? That's on the left side, and on the right side you have a right PICA. So, right and left posterior inferior cerebellar arteries come off of the left and right vertebral arteries and supply the posterior inferior surface of the cerebellum with blood. Questions? Okay, and PICA has a sister. And PICA's sister comes off the basilar artery. Okay, PICA's sister supplies the anterior inferior surface of the cerebellum with blood. PICA's sister, since it supplies the anterior inferior surface, is known as ICA. So this is the left AICA, and AICA stands for anterior inferior cerebellar artery. Okay, there's a left ICA and a right ICA, AICA. Yes,
Is that coming off the basilar?
that comes off the basilar. Tell me your name. Ashley. Ashley or Ashley? Ashley. Ashley. Okay. Yes, it's coming off the basilar. So both PICA and ASA come off the vertebral arteries, but ICA comes off the basilar. Coming off the basilar to supply the anterior inferior surface of the cerebellum with blood is ICA. Left and right ICA. AICA. So if somebody had a problem with their ICA, what kind of patient deficits might you would expect? Balance and coordination. Yeah, they're going to have difficulty with their balance and coordination, right? Because that's going to affect the cerebellum function. Is that a question, Avery, or just stretching? Just stretching. Okay. Okay. Moving on up the chain, there's one more important artery that we need to talk about for the vertebro-basilar system. And again, this one comes off the basilar, just below the level of the third cranial nerve. You're going to have another artery that comes off over here. And it's going to supply the superior surface of the cerebellum with blood. So believe it or not, it's called the superior cerebellar artery. Or this is going to be your left superior SCA, and this is going to be your right SCA, and SCA stands for superior cerebellar artery. Superior cerebellar artery is your SCA. Just one more little addition. And they're teeny tiny little arteries. They come off the basilar, and their job in life is to supply the middle of the pons or the medial pons with blood. So because of their function, that's how you can remember their name. These little arteries, little offshoots off the basilar, supply the pons and they're known as pontine arteries. Okay, pontine arteries are nothing more than small sheets coming off the basilar that supply the pons, the medial pons with blood. Questions? That's the hard part. That's the super hard part. Everything else isn't so bad. Just making more sense. Did you have a question, Ben? Let me see. Is there something you can't read? Everett? Pontine. Pontine. P-O-N. Like the ponds. T-I-N. Got it? Yes. Alex?
So, like, last class we talked about, like, the strengths and how there's the different kinds and how the superior is possible and superior was the house, right?
Yeah. So at below the level of the midbrain.
Yeah.
Yes.
So does the left SCA supply the superior, like, rostral, like, part that we're talking about?
It supplies the superior surface of the cerebellum.
Okay.
Yeah, think about it as cerebellum. Yes. Ashley.
So the pica, ICA, and SCA are all down.
Yes. FICA, ICA, and SCA, both left and right, are their sole job in life is to supply the cerebellum with blood. Correct. PCA mostly supplies the occipital lobe. We'll talk about that. We'll get there. You're ahead of us. That's good. Get ahead. Any other questions? Ben?
So this, where the right SCA, left SCA connect with the basilar, are they like attached to the basilar, or are they going behind it, attached to each other?
They attach to the basilar, so they're direct offshoots of the basilar artery. Okay, so they're coming off the basilar, just below the level of the third cranial nerve, coming off the basilar, they come back and supply the superior surface of the cerebellum.
So they're just offshoots.
They're offshoots, yeah. They're just like Pica and Pica coming off, but they're coming off higher up. Yeah, sure. Other questions? I think you're getting the hang of it already, so that's good. Okay, that's vertebrobasilar circulation. That's the hard one. Okay, if you get this one down, you're doing great. And if not, it'll come. Let's move on to the anterior circulation. Okay, that looks like this. You laughing at my drawing? I never said I was artistically inclined at all. I do my best. This is a happy person. So, yeah, this is going to be the anterior circulation. And what I've tried to depict here is this is the side of a face. This would be, if it were me, the right side of my face, right? You're looking at the outside of a face. You know, there's a mouth, there's a nose, there's the eye, top, and then bottom. Okay? And we're going to use this to draw in the anterior circulation. I can tell you it gets a little confusing, so I'm starting with one side. So the vertebrobasilar, you come up with two and you end up with one. That doesn't happen in the anterior circulation. So we're just going to start with the rightmost side. So we're just going to start with the artery that comes up here and supplies the anterior portion of the brain with blood. Now tell me, which artery coming off the common carotid supplies the anterior portion of the brain with blood? Internal carotid artery. So this is going to be the right internal carotid. So again, I'm using red for the internal carotid. I'm going to start here and I'm going to come all the way up. Okay. This is going to be, I'm just going to draw in my right internal carotid first. I'll label that. My right internal carotid. Okay, you're going to remember that? Coming off on the left side, common carotid comes off the aorta. On the right side, radius valve comes off the aorta, turns into common carotid, And then common carotid divides into internal and external carotids. Internal carotid comes straight on up to supply the blood, brain with blood. Just going to draw the right side. This is my right internal carotid, about the level of the eye. This internal carotid comes forward and actually loops all the way around that corpus callosum that we talked about last class. Okay, this is just the right side now. Okay, this first shoot comes off the internal carotid at about the level of the eye, and it is called this is going to be your right anterior cerebral artery, or ACA, anterior cerebral now, not cerebellar. Right, ACA, real simple, internal carotid comes straight up, about the level of the eye, forms a shoot backward, comes forward, and then goes backward over top of the corpus callosum, and forms the first main shoot we're going to talk about in the anterior circulation system, known as the ACA, or the anterior cerebral artery. Got it? One more, just one more on the right side that we're going to draw for the anterior circulation. And this is my right side. So if the artery is coming straight up here to about the level of the eye, it's going to flip over my corpus callosum and go backward. Now at the level of the internal carotid, I'm going to try to draw something that's coming. It actually comes about straight through my ear. So it starts here and then comes straight out through my ear. So let's draw that. I'm going to draw that like this. And this is intended to represent an artery coming straight out through my ear. We'll see it in another direction here in a minute. But this is going to be my right MCA. And MCA stands for middle cerebral artery. Okay, right internal carotid artery comes up about the level of the eye, forms the first major branch, flips over the corpus callosum. That's your right anterior cerebral artery, or ACA. There's another branch coming off the internal carotid that at about the level of the eye comes straight out, supply mostly the outside of my brain, the outside portion of my brain with blood, and that's going to be your middle cerebral artery, or MCA. Everybody got it? That's it pretty much for the anterior circulation. Now the confusing part happens when I try and connect it to the other side. So what I'm going to try and do is I'm going to draw the left internal carotid here, and I'm going to use a little bit different color. So what happens is the left internal carotid is going to come up parallel with that right internal carotid. Right. And then it's going to flip backward over that corpus callosum here. Okay. So this is like maroon color. This is my left internal carotid right here. Okay. At about the level of the eye, the left internal carotid forms a major shoot that comes off and flips over the corpus callosum. What do you think that's called? No, there's one on this side. Yeah, this is going to be your left ACA, or left anterior cerebral artery. Good. And then this was going to be harder to depict, so I'm just going to put like dotted lines. So the left comes up, flips over, but then there's that middle cerebral artery is going to come off the internal carotid and come straight out through my ear. So I'm going to try and depict that as a dotted. That's supposed to be going out the other side. Okay? And that branch is the same as the other side. This is nothing more than your left MCA, or middle cerebral artery. That's the anterior circulation to the brain. Right and left internal carotids come up, about the level of the eye, come forward a little bit, and then flip back over the corpus callosum. That major branch, first major branch, is your ACA, or anterior cerebral artery. The other major branch, that about the level of the eye, comes off, comes out through the ears. Those are your left and right MCA, or middle cerebral artery. Questions about that one? I think that one's a little bit easier. Did you have a question? Yeah, that's easier. Okay. Yeah, this confused look. Maybe that's normal. Don't know you well enough yet. Okay, everybody got the anterior. Okay, now what we're going to do is we're going to take the posterior system and we're going to hook them together. We're going to draw it on the same page. So, coming up here, I'm just going to put it right back here. You can do it. It's easy. You got it. So here you go. Two arteries coming up to form the basis of the vertebral basilar system. Left and right are vertebral arteries, right? So I'm just going to draw my left and right vertebral arteries coming up here. Boom, boom. And then at about the level of the pontomedullary junction, they meet. I'm going to try and make it a little three-dimensional. And then they're going to meet at about the level of the pontomedullary junction to form that one main artery that's going to be your basilar. Good. Whoever said basilar. So coming on up, the basilar artery is going to be here and about the left, just above the level of the third cranial nerve. It's going to form two main shoots. It's going to have one going back here on the left side, and then one going back here on the other side. And that's going to be your left and right posterior cerebral arteries. So let's go ahead and put, this is going to be your left PCA, nothing different than we just did, and this is going to be your right PCA. PCA again stands for posterior cerebral arteries. Okay, not that hard, right? Just putting them together. And there's an important point here. We're going to look at it a couple of different ways. I like to see it. This is looking at it from the side, and sometimes I think it's a little harder to see from the side. See that right? Yeah. But we're going to look at it from the side here, and then we're going to look at it from the top here in a minute. Okay, but just looking at it from the side, there's an important structure that is involved in connecting both the left and right circulation to the brain and the front and back circulation to the brain. Does anybody know what that would be? For here, the Kayla, right? Circle Willis. Yes, we're going to look at Circle Willis here. Circle Willis is nothing more than connecting the left and right halves of the brain. There's one important artery that connects the left and right halves of the brain, and that's going to be this little connector here. I'm going to draw the Circle Willis here in blue. The connector, it is an artery that connects the left and right anterior cerebral arteries. Just one of them. And that artery's main job in life is to connect the left and right circulatory systems in the anterior system. This is known as your anterior, it's in the front, communicating, because it communicates left to right, artery. Just one of them. The anterior communicating artery is a little artery that connects the anterior cerebral arteries from the left and right sides of the brain. Everybody see that? Okay, that connects left and right halves. Now there's another couple of arteries that are going to be responsible for connecting the anterior circulation with the vertebral basilar system. And those are going to come off the left and right internal carotid. So let's go ahead and start with the right internal carotid. This little connecting artery, part of the Circle of Willis, is going to connect the right internal carotid with the right PCA. Did I see that? So it's just a connecting system. Yes?
Does it touch the left internal carotid at all through there? Or
No, it's just, so it's three-dimensional, so that the left internal would, if you can put it back there. What's gonna happen is, you're gonna have one coming off the left internal carotid over here that is going to attach to the left PCA. Okay, and both of these, this is going to be your right posterior communicating artery. And then this one over here is going to be your left posterior communicating. And there you have. Sometimes it's a little harder to see from the side, but if you can imagine, you've got connection between left and right ACA with that anterior communicating, and you've got connection with the right and left internal carotid with the PCA in the back through your right and left posterior communicating arteries. So essentially, you formed a circle. And that circle is called the Circle of Willis. We're going to look at the Circle of Willis here in just a little bit more detail after the break. Okay, take a 10-minute break.